Assalamualaikum everyone. So the topic of today's presentation is infection control in restorative dentistry and mercury hazards. So starting with the topic, what everyone understand with the term infection control. It's basically a way to minimize the transmission of microbes in the dental office. Means how many transmission of microbes we are controlling or minimizing in the dental practice. This is what infection control is. And what is cross-infection? Diseases could be transmitted in a dental setting in three ways. There are three ways that a disease can be transmitted. One, from patient to the dentist. Okay? And second, from patient to patient. And third, the dental care provider to the patient. This is what cross-infection is correlated with each other. Okay, what kind of diseases can be spread during dental procedures? These are basically transmitted through blood, saliva, aerosols that are being spread in the environment of our OPD or dental practice. There are three types of contamination we are talking about here. Okay, first one is airborne contamination. Second one is direct, and third one is indirect. The example of airborne contamination is basically mask and high volume suction devices, in which high speed handpiece capable of producing air contaminants, example aerosols and spatter. So these are going to produce airborne contamination due to the like aerosols and spatter. The indirect contamination, there's a direct contact with the body fluid, saliva, blood. This is some examples of direct contamination. And indirect contamination includes touching the saliva contaminated operatory surfaces, handles, dental chair, other equipments, the dental chair, the door handles, and this is how we spread indirect contamination in the dental OPD. We are going to prevent the universal, what are the universal precautions that we can take while trying to minimize the infection control. We have to take the detailed medical history. That's really important for us as doctors to take the detailed medical history from the patient about what they have gone through, any procedure, dental procedure, medical history, what is it present in complaint, detailed history. Okay. Second, we have to take consider every patient a potentially infected patient, because some patients do not get their cells screened as well. Third, hand washing instructions, at least 10-second rubbing surface of hand. We should make sure to clean our hands. That's the way how we can minimize the cross infection. Third, personal barriers by protective eyewear, PPEs, and hair protections, gloves. That's how we can prevent the cross infection. Here we are, these are the pictures showing the hand washing, how we are going to hand wash. In this slide, they are telling that how you have to like rub your hand and proper follow the protocols. You can even Google the way on YouTube, like check it out of how to wash your hands. Okay, so here we are going to study about the precautions to avoid injury, how we are going to avoid the injury. We are going to dispose the sharp, special sharp needles in the special bends. There are special bends kept in the OPD or your dental practice for the sharp instruments. We have to basically, if we are passing on the instrument, we have to make sure to carefully passing on the instruments, and we have to prevent the needle stick injury as well. Two-handed, first example of the main, most important example of needle stick injury is the two-handed recapping of the needle. We have to do it single-handedly. That's why it's going to prevent the needle stick injury. Okay, what are the different infection control procedures? Disinfection. What is basically a disinfection? Cleaning an article of some or all of the pathogenic organism which may cause infection is the disinfection. Cleaning of the pathogenic organisms. Okay, what are the common disinfectants we can find in dentistry? This is the alcohol, glutaraldehyde, and chlorhexidine are the most common disinfectants found in dentistry. What high-level disinfection can be done with 20 to 90 minutes, can be done with glutaraldehyde, a dip for plastic instruments. Does not kill spores, but it can obviously disinfect the plastic instruments. Surface disinfection, we can do it with alcohol or chlorhexidine as well. So these are three types of disinfections. What are the disposable items in the OPD found or in a dental practice? These are the suction devices, these are the napkins, these are the paper glasses, plastic wraps, all over unsterilizable surfaces and equipment, rubber caps, needles, syringes. These are all the disposable items that need to be discarded right after their use. What is sterilization? Any process that effectively kills or eliminates transmissible agents such as fungi, bacteria, viruses, spore from a surface, equipment, or medication. Um, this is what sterilization means. Moving on to the next slide, instrument preparation before sterilization. How we have to prepare instruments before sterilization. We have to manually wash the instrument, we have to clean it, we clean it in an ultrasonic cleaner, we wrap it in a plastic bags and seal it. And then we send it for the sterilization. There are 4 types of sterilization: steam sterilization, chemical vapor pressure sterilization, dry heat sterilization, and ethylene oxide sterilization. One by one, we are going to talk about each sterilization method. Steam sterilization is the autoclave. It's the most recommended method of sterilization. Sterilization with steam under pressure. Okay, what's the temperature for it? It's 121 degrees centigrade for 15 minutes and 15 lb pressure. And regular cycle, this is the regular cycle. And what's the short cycle? 134 degrees centigrade for 7 minutes and 30 lbs pressure. This is the most asked question from the sterilization and infection control. Everyone should remember these temperature and minutes of sterilization. This is the most effective method of sterilization. Everyone does this in their clinical setups and OPDs. Surgical instruments and clothes can also be sterilized. But it can rust carbon steel instruments and burst. So we have to kept it in notice. Items sensitive to elevated temperatures cannot be sterilized. Some items that are elevated temperature, for example, the tap and dish or etc., it cannot be sterilized in autoclave. If we talk about chemical vapor sterilization, the chemical vapor pressure sterilization is also known as chemiclave. Sterilization by chemical vapor such as formaldehyde under pressure is called chemical vapor pressure sterilization. The temperature for it is 131 degrees centigrade at 20 lbs pressure, cycle time of 30 minutes. Okay, corrosion sensitive burrs can be sterilized without corrosion. In this, we can corrosion sensitive burrs can be also sterilized by chemical vapor pressure sterilization. Towels and clothes cannot be sterilized in chemical vapor sterilization. What is dry heat sterilization? Also known as dry clave. It can be achieved by 160 degrees centigrade for 30 minutes. The short cycle for dry heat sterilization is 191 degrees centigrade for 6 minutes. We can sterilize the carbon steel instruments as well in the dry heat sterilization. Heat sensitive items like plastics and rubbers can be damaged by high temperatures that I told you earlier as well. Okay, now coming to the next slide, ethylene oxide sterilization. It's the best method for sterilizing complex instruments and delicate materials. Automatic devices operate for several hours or night at temperature below 100 degrees Celsius. Example, sterilizing operating rooms can be sterilized by ethylene oxide sterilization. Very expensive instruments and very rare to find it. Okay, do all instrumental instruments needs to be sterilized? Yes, but we have categorized them according to their use to decide whether to disinfect or sterilize them. I'm going to talk about them in the next slide. There are three types of instruments, critical, semi-critical, and non-critical. Critical instruments needs is sterilization is a must for them. Examples, periodontic scalers, endodontic files that basically penetrate soft tissue, contacts bone, or in contact with the bloodstream or in the mouth of the patient needs to be sterilized at any cost. Semi-critical instruments are those instruments that contacts mucous membrane or non-intact skin, will not penetrate soft tissue, contact bone, enters into or contacts the bloodstream. Basically, it have to be sterilized as well. Should be sterilized as well. Example, mouth mirror, amalgam condenser, dental handpieces, it have to be sterilized. And what is non-critical dental instruments? These are the radiographic heads, cone, blood pressure cuff, face bow, pulse oximeter that can be disinfected as well. Where should infectious waste go? So, disposal of clinical waste, needles, syringes, sharp instruments, sharp items should be discarded in a sharp container that can be incinerated later. Other than that, infected blood and other liquid waste could be poured down in sanitary square. Contaminated gloves, masks, and other items should be discarded safely as well, so that it won't have that infection to other individuals as well. If I talk about water unit and handpiece asepsis, what is this? Water used for mouth rinse should be of potable standard, Water required for irrigation or tooth preparation, fine scaling should be no less than potable standard. ये भी portable standard का होना चाहिए हमारे पास. If I talk about the air and water lines, it should be flushed for a minimum of 2 minutes at the start of the day and 30 seconds between the patient. If you have open your OPD or your dental practice, try opening all your tap water and let it go to the sewer for 2 minutes. And in between the patient, you can do it for 30 seconds. Drainage and suction system. Tubing of high volume suction saliva ejectors, how we can sterilize that. We can flush with water after every patient, or we can flush with sodium hypochlorite 0.1% periodically. Other than that, the filters or vacuum should be cleaned of debris once a week. Is there a way to ensure that sterilization has worked? Okay, there are three ways we can ensure that sterilization has worked or not effectively. First way is the chemical one, second way is the mechanical one, third way is the biological monitors. In the chemical way, we change what we see is the color chain indicators. The color chain indicates that okay, the sterilization is being effective or not. The mechanical one involves the observing and recording the physical aspects, example, temperature, pressure, time of cycle when the sterilizer is being operated. While the biological monitors is the spore test. In spore test, if spore test found positive, the sterilizer should not be used until it has been inspected or repaired. Do we need to take additional precautions for known infected patients? Additional precautions known patients of HIV, HBV, and HCV, these patients should be definitely scheduled at the end of the list, and operators and assistants should wear 2 pairs of gloves, plastic ground cap, mask, and protective eyewear. We have to provide high volume suction should be used as well. Rubber dam should be applied to minimize the formation of aerosols. All used instruments should be packed in a labeled plastic wrap. After the procedure, all equipment and surfaces inside the operatory should be cleaned and decontaminated with appropriate disinfectant, 0.5% sodium hypochlorite. This is the additional precaution that we have to take from of patients involving HIV, HPV, HCV, and TB. Laboratory items. Impression should be rinsed thoroughly to remove visible blood and debris. Sprayed with the disinfectant and sealed in Ziploc bag before sending it to the laboratory to prevent the infection control. Who sets the infection control guidelines? It's basically the CDC, the for Disease Control and Prevention, OSHA, Occupational Safety and Health Administration, WHO, World Health Organization, PMDC, Pakistan Medical and Dental Council, HEC, for teaching programs, SHCC, ISO, and Hospital In-House Infection Control Committee. These are the organizations that sets the infection control guidelines. Okay, now coming towards the mercury hazards. Mercury hygiene. Mercury in dental amalgam restorative material is debatable for its possible health hazards because I have been reading about the research related to mercury spillage and use of mercury in the mouth. It's a debatable topic. Okay, what can have health risk for if not handled properly? Mercury vapor inhaled bloodstream. If it's high exposure, it can cause the corrosive bronchitis, pneumonitis, or less exposure होगा so it can affect RCNS, hyperexcitability हो सकती है, tremors हो सकते हैं in the patient. Sources of mercury exposure. Direct contact with mercury skin, indirect. There are two types, direct and indirect. Direct contact with mercury on skin and indirect consists of mercury vapor that includes accidental spills, manual mixing, leakage of amalgam capsules, malfunctioning amalgamator, heating of amalgam carriers for cleaning purpose, dry heat sterilization of contaminated instruments, squeezing excess mercury in clothes. These are the indirect mercury vapor things. OSHA recommends mercury in air acceptable as 0.1 mg per m cube in 8-hour shift. That is acceptable. Hygiene recommendation. During mixing and placement, we have to make sure only pre-capsulated amalgam can be used. Closed covered amalgamator should be preferred. Avoid skin contact. Use high volume suction with filters. Do not use carpeted flooring and OPDs and in your dental practices. Environment should be well ventilated, preferably with outside exhaust fan that helps going all the aerosols out of your dental practice. Okay, now coming towards the management of mercury spills. Never use vacuum cleaner in your for if the mercury spills. Never use household cleaning chemicals, chlorine or ammonia. It's going to cause a reaction in that. Never pour it down the drain. Never clean with broom or brush. Never move around with contaminated shoes. Use mercury spill cleanup kit. And what does mercury spill cleanup kit consist of? We are going to read it in the next slide. Here is it. Cleanup kit replacement if kit is not available. Put on latex glove. Gather all beads of spilled mercury droplets using small cardboard. Using eyedropper, collect the mercury and squeeze on a paper towel, Ziploc bag and label it. Leftover small droplets can be picked up by the duct tape, Ziploc bag and labeled. Then cover with sulfate powder, which will control the droplet and prevents its vaporization. So these are the things that you have to do if the cleanup kit is not of mercury is not available in your dental practice or dental OPDs. Thank you everyone. I hope you enjoyed the lecture.